In this video, we will discuss about pancreatic function test. What is the role of pancreatic function test? Used to evaluate normal functioning of that pancreas. Used to evaluate normal functioning of that pancreas and also find out, detect abnormality in the functions of pancreas. So detect abnormality in the functions of pancreas. Mainly tests are divided into three different groups. Analyzing pancreatic juice. Second one is analysis of product of digestion. Third one is estimation of serum amylase level. So analyzing pancreatic juice, analysis of product of digestion and estimation of serum amylase level. So starting with first, that is analysis of pancreatic juice. How we can collect pancreatic juice? For that, you have to insert double human catheter that is inserted, which is having a radio opaque tube. That is, we can trace it with the help of X-ray. So, radio opaque tube, that is to be passed either through nose or mouth till it reaches to the tip of the tube, reaches the duodenum near the ampulla of water. It has two set of hole, that is to collect pancreatic juice, that is for duodenal aspiration, and to collect the gastric juice for gastric aspiration. So it have two holes. One is collected pancreatic juice for the duodenal aspiration and collect the gastric juice for gastric aspiration. Other method that is used, we can also use a fiber optic catheter that is also introduced under direct vision into the pancreatic duct, and we can collect that pancreatic juice. Analysis of that pancreatic juice, that is collected after direct stimulation of pancreas. For that, what we are supposed to do, ask the patient or person to stay overnight fasted. After fasting, deodorant and gastric samples are collected. After fasting, we collect deodorant and gastric samples are collected, as we have introduced the tube in the morning. After that, intravenous infusion of secretin is given. Secretin is a hormone which stimulates bicarbonate secretion from pancreas. So here secretin is given. Dose is 12.5 unit per kg per body weight is given, and after that again the duodenal aspirate that is collected at the interval of every 10 minutes. Over next 80 minutes, you can see here, these are the different interval according to different parameter. Collected samples at the interval of 10 minutes for up to next 80 minutes, and this aspirated content, they are examined for volume of that content, pH of that content, bicarbonate secretion and enzyme. For the enzyme, we are injecting cholecystokinin also. Here enzyme we are using cholecystokinin. So normal volume of that pancreatic juice is that 2 ml per kg in 80 minutes. normal bicarbonate concentration volume, that is more than 10 minutes equivalent per liter in 30 minutes. Next test, we can use secretin as well as cholecystokinin. So combined form. First we have to perform secretin test, and after followed by we have give cholesterol intravenously, and the same procedure is repeated. So here what happened, because CCK cholesterol increases enzymes secretion. Now you get that pancreatic juice which is rich in enzyme, and this test is useful to find out. Suppose some person is having steatorrhea, that is fat in stool, and fat in the stool means fat is not absorbed. So we can find out what is the causes of presence of fat in the stool. There are mainly two causes. One is pancreatic insufficiency, means pancreatic enzyme are not there. Second causes, that is other malabsorption. Malabsorption symptom, that is in intestine pathology in pancreas. Because of malabsorption, so for that we have to perform this test. We are giving cholecystokine and find out whether enzyme secretion increases or not. So this is first test. First test we have completed number. The first one is analysis of pancreatic juice. Second one is, that is analysis of product of digestion, means one that is fecal fat excretion, fat content in the stool. Normally it is only 5 to 6 gram per day, but if there is pancreatic insufficiency, the fat is not absorbed because fat is not digested. So fat is excreted. Excretion of fat, that is 40 to 50 gram per day. Other tests that is to be performed, that is tripeptide hydrolysis test. So what is to be done here? There is synthetic peptide is given which is having vitamin B2, T4 thyroxine and para-aminobenzoic acid. What happened? This chymotrypsin is secreted by, it is the pancreatic proteolytic enzyme. So this separate this B2 D4 from para-aminobenzoic acid. So this P2 D4 are separated and this para-aminobenzoic acid is separated, and this para-aminobenzoic acid that is absorbed and that is excreted in that urine. So after giving this tripeptide, we have to collect the urine sample and to find out that whether para-aminobenzoic acid is there in the urine excretion or not. And activity of this chymotrypsin, that is studied by urinary excretion of para-aminobenzoic acid. So that is another test. Third variety of test, that is estimation of serum amylase level. Normal level of 50 to 120 unit per liter. This is commonly increases in patient of acute pancreatitis. So to diagnose or to find out acute pancreatitis, you have to estimate the level of serum amylase. So this is serum amylase test. So This is all about pancreatic function test.